Good afternoon. Welcome to Dermatologist 101. My name is Carolina Castillo and today I will be assisting you. I see that your reason for visitation is for a facial sore that has not been healing properly for several months. It seems to me to be some kind of skin cancer. There are several types of skin cancer. The most common type is the squamous cell carcinoma. It starts off by looking like a red firm bump or a sore that heals and then reopens again. It's normally formed on the skin that is frequently exposed to sun. Another similar skin cancer is the basal cell carcinoma, which I believe you have. The basal cell carcinoma is a sore that does not heal correctly. There is also an actinic keratosis, which is where there's dry, scaly patches or spots on the skin. It is mostly seen in people who are over the age of 40 due to many years of sun exposure. If you do have skin cancer, there are multiple ways of treating it or removing it. There can be a biopsy done, which is just a sample of the skin that's affected is removed and it's examined. There can also be treatment of radiation, immunotherapy, and even chemotherapy for the affected area. Or it can be surgically removed by a simple excision, which is basically cutting it away, or an electrodesiccation and curettage, which is scraping the tumor from the skin and then burning the tissue with an electric needle, or a cryosurgery, which is basically freezing the area with liquid nitrogen. For preventative measures, it is suggested to limit the sun exposure between its highest peaks, which is between 10 a.m. and 2 p.m. If being outdoors, please apply sunscreen, especially with the SPF of at least 30, and try to apply it between 1 to 2 hours every time you're outside. I also highly recommend to avoid tanning booths because they expose people to get skin cancer. And at this point, anyone is really at risk of having skin cancer, but it is commonly seen with people with fair skin, or people who sunburn easily, or even people who have family members that have had previous skin cancer, or if you've had previous skin cancer, it's easier to come back again. I recommend you do self-checks. The best time is after a shower or a bath, and this is where you check your whole body using a mirror to see if any of your blemishes or moles or birthmarks have been affected or are becoming of a larger size, their texture has changed, or their color, and if so, if you happen to notice any of these changes within your skin or new spots appearing in your skin, please call your dermatologist and schedule an appointment and have it seen by them.